and surgeries would be covering 50,000 patients in Cambridgeshire and the surrounding area. And they said they had to do this because we've got a shortage of GPs in this country and an ageing population. And this was the only way to go. But I wondered if this North and South Alliance company is what you were talking about with the new GP contracts that are going to be controlled by companies and take the patient lists. I don't know if you know anything about our local area and what's going on here. That's it really.
That's okay. So I think it's certainly worth investigating whether, for example, Optum might be involved.
Yeah.
They need the expertise of the private sector to sell all this to everybody. It doesn't come easy to most of us to do what is going on. In fact, they're sort of running out of people to carry on with the charade. But it certainly needs investigating. And in terms of what else people should do, I think this is the key. I don't want to finish the meeting without telling you what can be done. First of all, tell your immediate family what's going on. Tell your social circle. If you're a member of any group, hold a meeting. Maybe we've got our old film on YouTube. It's an hour long. Show it and have a discussion after. Pick up the phone. Ring up national radio stations whenever you have the opportunity to tell them what's going on. Engage with your local paper and start to get the message out there, because the more people who become aware, the more people that will mobilise and join the fight. So information and spreading that information is key.
I'd like to add a comment, if I may. Very quick comment.
Yeah.
One of the things you have to remember is that you can't trust any of the government bodies. Last year there was a review by NICE, the National Clinical Excellence Committee, on treatment and diagnosis of Lyme disease, a tick-borne disease that's extremely nasty. This is supposed to be evidence-based medicine. All the meta-analysis shows that the test misses at least 45% of infections, and then patients are told to go away. And some, not a few of them die. NICE excluded all the evidence that the test is faulty. They just ignored it. They just said, oh, there's so many different results in all these tests that we can't trust these publications. I thought, what? I'm the only scientist. And I just found that incredible. They basically said that because the studies that had looked at the test showed these huge errors, they were going to just ignore that data. And they didn't ever, in that review, then put the point that this shows the test is unreliable. They ignored it. They still talk about that test. And the test is crap. They were repeatedly challenged to pay attention to the manufacturer's instructions, the people who make the test kits for the ELISA and the Western blot, which says that a negative result does not mean absence of infection. And that has been the malpractice that's been going on in the NHS for more than 30 years, and it's still now embodied in the NICE recommendations. If you fail the ELISA, you're deemed not to have the infection, which, as a scientist, I find absolutely unacceptable. And as someone who's been trying to get diagnosed for Lyme disease for more than 10 years, and I've had a heart attack with damage to my left ventricle, and I've had a stroke that's wiped out my right side vision, plus all sorts of horrible symptoms, that makes me very, very angry. So don't trust something that's, don't trust NICE. They're all bent, I'm afraid, because money comes into it, and government pressure.
Thank you. Just one little word about networks.
Thank you.
Networks start off with GP practices covering a population 30 to 50,000 or more, can go up to 300,000. So the design is for them to get bigger and bigger. They start off as GP practices, but every year they add on other medical providers like dentists, podiatrists, a virgin supplier of nursing care or out-of-hours care. Private companies can join in year by year, so the idea is that there's an evolution and they expand, but they're public and private providers all in one. Now you mentioned social care. Social care at the moment in this country is means tested and can be charged for, and it's the budget from the local authority is going to come into these networks with the social care. You can charge for that. At the moment you can't charge for NHS care, but if you put them all in one organisation, they're going to eventually slip the boundaries and they're going to start charging for healthcare. See, the networks are the production basis of the integrated care systems. So you've got public and private together, health and social care together. They're making these new structures all ready for private health insurance companies to run because they will charge. So that's why we have to say to these GPs, don't get into these networks. Hang on to your GP practice and your NHS contract. That's the best way to fight it for the time being till we can get the whole thing changed. But they are the structure, the new structures ready for HMOs.
Can I just say something about, again, integration sounds great, yeah? Who could disagree with integration? Except they've spent 30 years disintegrating the NHS. The form of integration they're interested in is, as Anna says, the budgets. It's about pooling the budgets. So if you can get public health budgets, social services budgets, what's left of them, and the health budgets, you have backdoor entry of means testing. Charging, the infrastructure for charging is being brought on the back of health tourism, which is a negligible cost to the NHS. So they're putting in this massive infrastructure, and as I said, you'll get this middle class drift over to the insurers. But there's one group of people they need to keep away from the insurers to prevent the bad headlines, and these are the very sick. So they've come up with a cunning plan. Anybody know the cunning plan? It's called a personal health budget, where they give a very generous budget to the 10% of the sickest, and the GPs will be included in selecting these people out, flagging them up. They'll give them a, let's say, £10,000 personal health budget to spend as they like. Meanwhile, the healthy drift over to the insurers, and then when the time's ready, when the critical mass have moved out of the NHS, you pull the plug on the personal health budget.
Like the PIP.
Right, so you've avoided the negative headlines of these expensive people being rejected by the insurers.